Hello, may I come in?
Yes.
Hi, good afternoon. My name is Antonio. I'm going to be your student nurse. I'm with Tarrant County Medical Center. Today we're going to be doing a quick assessment on you, but before we do that, I want to make sure that I have the correct patient. So can you please verify your last name and date of birth?
Last name Leon, first name Celso, date of birth April 24,
All right, and I'm
1988.
comparing that to his armband, and I see that we have the correct patient in the medical records. Do you have any allergies?
I'm allergic to penicillin.
Okay, so I see that we have documented that you are allergic to penicillin. Can you tell me what kind of reaction do you get?
Usually breaking hives.
You're breaking hives. Okay, so I see that we have documented, and I see you have a bracelet, which is great. Mr. Leon, I'm just going to ask you a couple of questions. They may be silly, but they're part of the assessment. Can you please tell me what year are we in?
2020.
We're in year 2020, perfect. Can you tell me who is the president of the United States?
Currently Donald Trump.
Okay, can you tell me where are you at right now?
I am at Tarrant County Community Hospital.
Okay, perfect. Can you tell me what brings you in today?
Just here to get an annual checkup.
All right, so the patient is alert and oriented ×4. So we're gonna start first by doing a quick, we're gonna be doing a head to toe assessment. We're gonna start with your hair, your head, your nose, your eyes, your ears, and your throat, and then we're gonna move and do a neuro assessment, okay?
Okay.
Is that okay with you?
It's okay.
All right, so I'm going to perform hand hygiene, and I'm going to don clean gloves. And it's taking a little longer because I just sanitized my hand. This happens in real life. All right, so I'm going to start by palpating your skull, and I'm going to be looking for any lesions, any abnormal bumps, any signs of balding or infestation. So I'm checking the patient's skull. Everything looks good so far. No signs of infestation, no bald spots. The hair looks clean and healthy. All right. So now I'm gonna go ahead and check the symmetry of his head. Head is pretty even. It goes with the body, the size and the shape of the body. I'm gonna look at his eyes. The eyes are symmetrical as well. So is his nose and his ears. His nose, when you draw a line, they go directly to the pinna of the ear, which is normal. Now I'm going to go ahead, and you mind if I take your glasses off for a minute? You can take them off. I'm going to go ahead and ask you to look up, and I'm going to assess the conjunctiva. All right, it looks pink and moist. No signs of conjunctivitis or any of that. I'm gonna ask you to look down, and I'm gonna look at the sclera. The sclera looks white and shiny. There's no signs of jaundice or anything of the sort. The eyes look good. Now I'm gonna go ahead and I'm going to grab my pen light, and I'm going to ask you to stare at an object on the wall. Okay, and I'm gonna check. Perfect. Now let's let the eyes readjust, and let's do the same with the other eye. All right, and both pupils react to light properly. Palpate the jaw. Check for the jaw. Check for any abnormal findings, any masses, and everything that looks good. I'm gonna ask the patient to open his jaw and close it. All right. There's no clicking sounds. There's no abnormal findings. Do you have any tenderness there?
No.
No? Perfect, so that sounds good. I'm going to go ahead and assess his lymph nodes and his frontal lobe and his maxillary. Let me know if you feel any tenderness.
No.
And he reports no tenderness, so that's good. Now I'm going to go ahead and check the patient's thyroid. So I'm going to ask you to put your head back for a minute, and I'm going to assess the area. There's no swelling. I'm going to ask you to swallow, please. All right, there's no abnormal findings in his thyroid. It is pretty symmetrical to his larynx, and it's straight down forward, so that's a good sign. Do a quick test on your ear, so I need you to cover one ear. And I'm going to whisper a word, and I want you to say it out loud, okay?
Okay. Future nerves.
Okay, let's do the same with the other one.
2021.
There we go. Thank you. So I see that the whisper test, the patient was able to participate in it. So now I'm going to have you cover one side of your eye, and then the right side of your eye, and then I want you to let me know when you no longer see my finger, okay?
Now.
Okay, I'll do the same with the other eye. Let me know when you can no longer see my finger.
Now.
All right, so peripheral eyesight is good. Now I'm going to have you open your mouth. Open big. Stick your tongue out. All the way out. All right, I see a uvula. I don't see any signs of missing teeth. I do see some fillings, but no missing teeth. Teeth are good. Can you bring your tongue up? All right. The bottom of the tongue looks good. I want to check the bottom of the tongue because that's usually where mouth cancer hangs around. The sides of the mouth are also good. They're pink and moist. All right. So now that we did that part of your assessment, we're gonna go ahead and move on with the neuro. So I need you to put your palm of your hands like this, and I'm going to need you to close your eyes. And I'm going to write something first in your left hand, and let me know what that is.
Number 8.
And then now with your right hand.
The letter Z.
Perfect. So you did well in that one. Now we're going to go ahead and check for your Babinski effect in your feet. So I need you to place your feet over here, and let me know if you feel this. Okay, that's good. Let's do the other one. Okay, good. Put your feet down. Now we're gonna go ahead and we're gonna I'm going to be touching different parts of your body, and you let me know when you feel it. Just say now. Okay, you ready?
Now. 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 Now, 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 now.
Okay. Now I'm going to touch you, and it's going to be either sharp or dull. So I need you to let me know if it's sharp or dull. You ready?
Dull. Sharp, sharp, dull, sharp, 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 dull, sharp, 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 dull, sharp, dull, 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 sharp, dull, dull, sharp, sharp, sharp.
Okay. Good. Now I'm going to put a series of objects in your hands, and I need you to try to figure out what it is. Okay. So I need you to close your eyes, and if you could please place forward your right hand. Let me know what that is.
It looks like a coin, like a quarter.
Okay. Thank you. Now we're going to put the next item, and let me know what you think this is.
Paperclip.
Perfect. Now the last one.
A marker.
Perfect. Now let's do the same thing with the left hand. Can you tell me what that is?
A paperclip.
Yep. Thank you. Can you tell me what this is?
Like a cotton ball.
Perfect. And can you tell me what this is?
Like paper, sticky note.
Yep. Thank you. Perfect. So now that we did that, now we're going to go ahead and I'm going to have you place your hands forward and try to touch each finger as fast as you can. There we go. Good job. That was good. Now we're going to try to do the same thing with your toes. Check the position of your fingers. Try to do the same thing. Wiggle them around. Okay. Good. That looks now good. Now we're going to go ahead and I need you to put a finger in your nose. And then I'm going to need you to focus on the pen light and then touch each where I go. You ready? As fast as you can. All right, good. That was good. That was good. Now I need you to place forward your right foot and touch your left shin. And like just kind of brace over it. Perfect. Now do the same thing with the other one. Okay, now that's good. That's good. So the patient was able to do all his neuro assessment checks in good standing. I need you to do one more for me, and that's with your hands. I need you to place your hands forward and kind of tap them with your thighs back and forth as fast as you can. Perfect. Patient was able to do that check as well. So that's all that we have today. Thank you so much for your time. We'll see you next time.